Hello everyone, my name is Curie from Seoul, Korea, and thank you very much for organizers for inviting me to this important meeting. My duty is evaluate to which degree your government is involved in transplantation, and do we find any unique aspect in the government involvement of our country compared to other countries. And the second, in order to achieve or improve self-sufficiency in transplantation, what would be necessary? And for this, I did some literature review and email exchanges, and we would like to make some further research and survey questions. For email exchange, we had 10 participants, and among those, 5 were belonged to most prepared countries according to Global Health Security Index. And my literature review was heavily dependent on the third global consultation organ transplantation report of Madrid resolution, which has been published in Transplantation in 2011. National responsibilities in self-sufficiency were summarized in 3 categories of increasing organ availability, ensuring fairness and justice and transparency, and preventing the needs of transplantation. And among those, I would not discuss about tissue donation related issues and preventing the needs of transplantation. So my talk will be focused on increased organ availability and ensuring fairness, justice, and transparency. The role of government is very important for self-sufficiency, and the national accountabilities consist of capacity control and regulatory control and the ethical context. National accountabilities in capacity management include a development of adequate and appropriate healthcare infrastructure and adequate and appropriate financing. National accountabilities in regulatory controls are adequate legislation, regulation covering procedures, and systems for monitoring and evaluation. National accountability in ethical context is national authorities need to lead a normative change from perception of organ donation as a matter of rights of donor and recipients to one of the responsibility across all levels of society. And second, meeting needs of patients while avoiding the harms of transplant tourism and commercial donation from living persons, which needs to consist with WHO guiding principles. So, the role of government in organ transplantation can be summarized in 2 categories of establish legislative and regulatory framework and establish national agency, and in other words, National Transplantation Organization, NTO, which needs lots of effort to establish in many countries who are just start transplantation program. Essential components of legislative and regulatory frameworks are for legislative framework, determination of death, legislation concerning organ trafficking, establishment of national authority, and basis of consent, that's opt-in or opt-out, and governance of organ procurement, and fair and transparent allocation, and proper data collection. Regulatory framework should include all of the living and deceased organ transplantation, which needs a ministry regulation and which needs medical protocol-based guidelines. Fortunately, most of the WIPRO countries had legal requirements which fit basic concept of organization, and also most of the countries already established national authorities of their own country. Then, what would be necessary to achieve self-sufficiency in legislative and regulatory framework way? We think mandatory deceased donation or presumed consent or first person authorization law will be necessary. And secondly, mandatory reporting of a possible deceased donor will be very helpful to improve self-sufficiency. The national authority is very important, as we have learned from Spain model of ONT in regulating donation and transplantation activities, maximizing donation from deceased donors, and protecting well-being of living donors. And the third global consultation of Madrid showed fields of organ transplantation structures and organization covering by national authority under the legislative framework. For structure and organizations, healthcare infrastructure, organ procurement organization, and the transplantation coordinating authority of allocation and waiting lists are under operational requirement, and regulatory authority and the donation and transplantation registry is under regulatory requirement. Among those, I think regulatory authority plays the most important role of national authority. National authority should have the oversight of standards, practice and performance, and provide criteria and guidelines, also certify and authorize transplant-related process and organizations. In detail, each functional system should have oversight and monitoring and evaluation through national authority, not only performance and reporting, but also compliance with ethical principles and reporting on ethical activities. NTO should provide criteria and guidelines in each procedure and process and criteria, and the certification and authorization should be properly delivered, also reimbursement process. And to improve self-sufficiency, Professor Beatriz Rodriguez-Gil recommended the donor coordination network supported by National Authority of ONT, and training on donation for professionals, and other programs such as quality assurance program and coordinating the relationship with the media. We think reduce the financial burden of donors is also very important to improve self-sufficiency. As you see here, procurement expenses for donors has been paid by state, sometimes private health insurance, sometimes by recipients or other tools in different countries. Then, financial burden for living donors. For reimbursement, DOI approved the cost of any medical and psychological evaluation and the cost incurred in arranging and effecting the process, and also medical expenses included for post-discharge care of the donor, as well as lost income in relation to donation. But in Korea, we can be covered by 1 and 3, and 2 and 4 should come out of pocket money of the donor. So in Korea, out-of-pocket costs of living donors listed here are lost wages and travel expenses, and long-term health maintenance, and incidentals, and also donor may have a disadvantage in future insurability. All of these things will discourage for possible donors to donate their organs to the patients. Not only in Korea, but also Canada has reported that about 4,000 to 5,000 Canadian dollars should be paid out from the out-of-pocket costs because it's not reimbursable. So, best practice guidelines to increase cost recovery and minimize donor burden under the regulatory compliance will be needed to increase organ donation. In 2016, a statement of DICG to families of deceased organ donors has been published by Professor Capron and others. That means financial burden related to deceased organ donation is also sometimes get difficult for countries with no or insufficient government support for donation, and that usually by covered recipient, sometimes recipients' hospitals, until they reach to the government payment system. On the other hand, funeral costs or hospital expenses can be paid to the donor families as an incentives in several countries, because they think without such financial incentives, sufficient organ would not be donated. This is really outside of the circle of ethical transplantation practice by DICG's statement. Fortunately, many countries does not have this kind of financial incentive system, but several countries are still having financial incentives like funeral fees paid by the government, like Korea. We experience that the monetary support for the families by the government, deceased organ donation rate, actually it decreased. And after we changed the system of reporting system and organ procurement organization, then we can really increase the deceased organ donation, as we published in the Transplantation journal. However, Oriental countries think it's the way to express thank to the families financially is acceptable in some sense. Doing these financial incentives for the donor families had some adverse impact from time to time, because the family get upset to each other about who is getting this money, and sometimes the families feel offended when they think they are paid by the lover's organ be donated. So in that sense, developing non-financial way of compensation like memorial park and various activities to express our thanks to their families. The next structure is donation and transplantation registry, and this registry is important for monitoring and surveillance and operational support, outcome prediction, and resource of transplantation research, thus improve utility of organ transplantation. It has living and deceased donors registry and the transplantation candidate and recipient registry. Not only demographic findings, but data for operational decision, such as relationship to recipient and country of residence, or donor card holder, or donor status of potential eligible and actual and utilized donors, and cause of death, etc., should be included. And the data on initial medical evaluation is very important, especially for deceased donors, as well as immediate and long-term consequences of medical and psychological complications. So, to improve self-sufficiency, a transplantation registry should link data to waiting list and allocation system, and merging data with National Health Database, and also linking annual transplantation data to global database such as GODT to improve international collaboration in the databases. Because currently donors and recipients are traveling everywhere, so just for example, to protect living donors, we really need global collaboration to build up the database. And not only the protecting of living donors, we also would like to see the current status of transplantation tourism using global data, And also, we probably need another data set for emerging acute respiratory virus disease or other infectious disease. Coordinating authority for allocation and rating system is important for self-sufficiency by ensure traceability and ensure equal accessibility, and also comply with allocation rules and policies of utility and justice and respect for persons. Healthcare infrastructure is also needs to be supported by national transplantation authorities, and to improve self-sufficiency, expanded criteria donors management and DCD management, and capacity building for ABO incompatible transplantation, and capacity building for transplantation for hypersensitized patients will be strategies to increase the donor pool and access to organ transplantation. Organ procurement organization is really essential structure for national authorities. To improve self-sufficiency, we need to develop critical pathways of each step so that we can see which step has a room for improvement. And to maximize organ donation from deceased persons, we also need to develop and maintain highly qualified organ procurement professionals, and should provide adequate education for OPO professionals. Moreover, to achieve self-sufficiency, in Korea, we established an independent professional national organ procurement organization to perform the procurement process in whole country, and ONT developed new strategies of ICOD, intensive care to facilitate organ donation, which you will be here during this conference from Beatrice Rodriguez-Gil, and ECD, DCD, and pediatric donation, and participation of private healthcare system to improve organ donation. Sometimes improve identification by thorough evaluation of organ donation process using medical record review and hospital attitude survey. It will help to improve organ donation, and sometimes develop early stage donor identification and notice program, which we developed as a DIP link, is also helpful to improve the organ donation. And not only that, we thought public awareness education organization or structure under the control of operational requirement, and the coordination and policy structure for regulatory requirement is also very helpful to improve self-sufficiency. Public awareness structure can be controlled by government, which can be more systemic and reliable, like ONT system, but also there are many NGOs can make a coalition which self-starting and prompt system. Korea, the Korean Society of Transplantation made a vital link, an NGO which covers lots of programs and media interaction, and including education. To improve self-sufficiency, we think we need to develop high school education or sometimes school education program for organ donation. And second, we should oversight over online and offline contents. Like Korean TV, some deceased donor can survive to come back to life or something like that. It's really confusing our people. And the third one, we need to work together through networking and linking, especially with eye and tissue donation programs. High school education program is one of the topics that we are facing, because the students' education, we can educate them in depth about the value of organ donation. This education, not by public relation, we can propagate the value of organ donation not only to the students but to the school teachers, and then the family members, which really have a good impact to the society. Policy and strategy system development is very important in order to overcome the barriers between different government structures and bodies. So Australia had developed national policy in every detailed system, between every detailed system, to increase organ transplantation. And the Philippines developed a policy to the patient with COVID-19 in transplantation. Like this, I think global living donor protection policy and the program is quite essential, because protecting donors is one of the very important way to improve organ donation, which will eventually achieve self-sufficiency. However, as you see in this table, only a few countries have this global concept, and health equity in organ transplantation should be pursued. So the policy for organ donor protection is needed, like adopting independent organ donor advocate, or provide lifelong medical and psychological follow-up and care for the organ donors. So from evaluation to donation and post-donation, organ donors should be supported by global living and donor registry-based follow-up. And we have to find solutions for follow-up deficiencies, and we have to find a way to protect the vulnerable. To overcome health inequity is another very important issue to reach or improve self-sufficiency in organ transplantation. In India, there are government-driven support called Ma Yojana and Ma Bachaya Yojana, which covers below poverty line populations as well as middle-income class populations. And there are many charitable organization funds which can support organ donors. So in conclusion, we think public awareness and education structure or organization is needed under operational requirements, and also coordination and policy structure or organization is needed under the regulatory requirements. Also, the legislation and regulation of mandatory deceased donation or presumed consent or first person authorization will be helpful, as well as mandatory reporting of presumed deceased donor and reduce financial burden of living donors. For system-wise, national independent OPO, which will cover education and maintenance of coordinators, as well as transplantation registry with the global collaboration and the long-term follow-up of the living donors, and education on organ donation in school, and make committees for transplantation policies and coordination, and develop non-monetary rewards for deceased donors and their families will eventually improve the self-sufficiency. Programs of critical pathway will be very helpful to evaluate the space for improvement, and improve donor identification, a program of donor action and death audit, and early point presumed donor referred to OPO will be valuable, and utilize organs from ECD, DCD, and ICOD system will be also meaningful. Allocation rule for maximal utilization and paired kidney exchange program will also improve organ donation, and that will eventually make us to achieve self-sufficiency. I would like to express my sincere thanks to my friends who sent me all kind of valuable email information about their country and valuable ideas. And I would like to express sincere thanks to those who participated in our Madrid resolution meeting of 2010. And we think it's already 10 years when we did Madrid meeting. So it's really time to re-evaluate the current status and go further from here. Thank you very much for your attention.